Find yourself in your comfortable position, whether sitting, standing, or lying on the ground. And now connect to your breath. The breath that comes in and the breath that goes out. And we're going to do a nice round of breathing here, just focusing on the inhalation and the exhalation of your breath. Coming into your body, whether it be through your nose or through your mouth. Connecting to where that breath is going. Is it going to the lower belly? Is it going to the chest? Is it going to the head? And then feeling that breath go out, whether it be out of your mouth, out of your nose. Feeling that breath leave in the lower belly, the chest or the head, contracting and letting go of that breath. And then find that repeated breath, connecting to your belly, your chest, and your head, until the breath is equal in all. Your breath in, into your lower pelvic floor, your chest and your head expand, and your breath out, feeling the contraction of the head, the contraction of the chest, and the contraction of the belly. And visualizing yourself as a balloon that expands and compresses with every breath in and every breath out. Feeling your space expand. The energy around you with every breath in gets bigger and bigger, filling the room that you're in. And breathing out and feeling all that energy compress and harness into your heart center. Breathing in and feeling the expansion of your body, the expansion of your heart, the expansion of your spirit. And breathing back out and feeling it all come back inside. Follow your breath in and your breath out. Finding your rhythm, finding your rate, finding what's most comfortable for you and what's most challenging for you. Whether you want to go slow breaths or quick breaths, whether you're starting your day or you're ending your day, or you're just throughout your day and breathing and connecting without ceasing. Breathing all the way in and breathing all the way out. Keeping the visualization into your pelvis, into your chest, and into your head. Follow this for the next couple minutes. Finding your breath, visualizing your body, feeling your energy moving, and connecting to all the spaces within. Feeling the expansion and feeling the compression. Letting the mind go of thoughts. Letting go of the past. Letting go of any thoughts of figuring things out now. And just stay present in your breath. I am breathing in and I am breathing out. may be the only thoughts that come into your mind. I breathe in and I breathe out. I feel the expansion of my body as I breathe in, and I feel the compression of my body as I breathe out. As I feel the energy expand and compress with each breath, I am in connection with myself. I am in connection with my breath. I am in connection with this present moment. Not my past and not my future, but this space, right now, with each breath in and each breath out. All right, now we're going to move into our normal cranial sacral breathing, connecting to your pelvis first, and feeling your lower pelvic floor from your tailbone to your pubic bone to the left and right ischiums that you're sitting on. Feeling that hammock of muscles moving, expanding in when I breathe in, and compressing up as a kegel when I breathe out. I breathe in and I breathe out, feeling the relaxation and the compression of that pelvic floor. Breath in, let it go. Breath out, contract it up, 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 up. Breathe in, let it go. And breathing out, contracting it up, up, up. And now visualizing my diaphragm with the lower pelvic floor. Breathing in, letting it all go. Diaphragm dropping down. And as I breathe up, the kegel moving up, 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 up into my diaphragm, feeling my diaphragm pushing up into my chest. And as I breathe in, letting it all drop down, 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 down. Feeling the expansion of my pelvis, the expansion of my diaphragm in my chest as I breathe in. And as I breathe out, everything compresses. The compression of my chest, the pulling up of the diaphragm, the pulling up of the lower pelvic floor. As I breathe out, letting it all go. And now connecting to the cranial sacral breathing. As I breathe in, I'm letting everything go. And as I breathe out, I'm compressing and compressing and compressing everything up and in. From my pelvic floor to my diaphragm into my skull. I breathe in, I feel the expansion of my skull. I feel the expansion of my diaphragm, and I feel the expansion of my lower pelvic floor. I now focus more into my lower pelvic floor, the pubic bone, the ischiums, and the tailbone, moving in and up as I breathe in and out. Feeling that lower pelvic floor drop when I breathe in and contract strongly and upwardly as I breathe out. Breathing in and breathing out. Connecting to this lower pelvic floor for a number of breaths in and then a number of breaths out. Letting go and contracting up, strongly squeezing the glutes, squeezing the legs, squeezing the lower pelvic floor. Breathing in and letting it all go. Breathing out, contracting, contracting, contracting. And breathing in, letting it all go. Breathing out, contracting, contracting, contracting. Breathing in, letting it all go. Breathing out, contracting, 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 squeezing hard. Breathing in, letting it all go. And now moving my attention with the pelvic floor up into my diaphragm. As I breathe in, I feel the diaphragm dropping down with the pelvis. And as I breathe out and squeeze my lower pelvic floor and squeeze my glutes, I squeeze the diaphragm and I feel it pulling up into my heart center. As I breathe in, letting it all go. Breathing out, contracting, contracting, contracting. Both the lower pelvic floor and the diaphragm, all the way up into my heart center. And breathing in and feeling it all expand out. Expanding into the room. Expanding as far and wide as I can experience and feel. And as I breathe out, pulling that energy in, receiving the strength as I contract the lower pelvic floor and I contract the diaphragm. I squeeze the chest as I breathe all the air out. And I breathe the air in and I let it all go. Feeling the expansion get bigger and wider and more encompassing. The front of my body, the sides of my body, the back of my body, all the way up through my head and all the way down into my feet. Following that breath in, expanding, 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 and breathing out and contracting and pulling it all in, all the way from my feet, my legs, my lower pelvic floor, my pelvis, my diaphragm, into my heart center as I breathe out. Now focusing my attention on my head and feel my head expanding with the diaphragm dropping down and the pelvic floor dropping down as I breathe all the way in. And just the same as I pull the energy in, as I breathe out, squeezing the lower pelvic floor, squeezing the diaphragm into the heart center, feeling my head squeeze and squeeze tightly, and breathing in and letting it all go. And as I breathe out, squeeze my eyes. Squeeze them really tight. Feel the compression of my head. Feel the compression of my diaphragm up into my heart center and squeezing the lower pelvic floor up. And then let it all go. All the stress on my face and my eyes is let go as I breathe in. The diaphragm drops down and the lower pelvic floor drops down. Breathing in and breathing out. Feeling the energy expanding and compressing with each breath. And now connecting to the microcosmic orbit. As I breathe in, visualizing the energy moving down from my head to my feet. And as I breathe out and contract everything up, the energy goes up through my sacrum, up the spinal cord, up into my skull base, all the way up into my mind and my brain, connecting to where it started. As I breathe in again, and the energy goes down. Breathing up, the energy goes up. Breathing in, the energy goes down in a nice circle. It's like a hula hoop was in the front and in the back, splitting my body in two, to a left and to a right. As I breathe in, I feel the energy move down as everything drops and relaxes. As I breathe out and contract everything up the spine, the energy moves up and around. and back down the front as I breathe in. Breathing up and breathing down and breathing out and breathing in. Feel the pumping action of the cranial sacral pump. Now take this time to really visualize on your own breath, your own contractions, and your own visualization of the movement. Down and up, down and up, in and out, in and out. Relaxed and contracted, relaxed and contracted. Find your breath again, letting go of the contractions of the cranial sacral pump and just finding your breath and feeling the expansion and the compression of the pelvis, of the chest, and of the head as you breathe in and as you breathe out. And become aware that all the systems are connected and united and moving as one. Now focusing on the reverse abdominal breathing, where we breathe in and we contract the pelvic floor, contract the diaphragm, and squeeze the head and squeeze the eyes as we breathe in. As I breathe out, I let it all go. Relax the eyes, drop the diaphragm, and drop the pelvis. As I breathe in, I squeeze it, squeeze the pelvic floor, squeeze the diaphragm, squeeze the eyes, squeeze the head as I breathe in. As I breathe out, I let it all go. Repeating, breath in, squeeze, breath out, relax. Breathe in, squeeze, breathe out, relax. Breathe in, squeeze, breathe out, relax. Breathe in, squeeze, and breathe out, relax. Visualize the pelvic floor, the diaphragm, the head. Relaxing the head, relaxing the diaphragm, relaxing the pelvis as you breathe out. And now visualize the energy moving in reverse, that hula hoop. As we breathe in, the energy comes from my pelvis, up my organs, up into my mind. As I breathe out, the energy goes down my spine, down into my sacrum, into the lower pelvic floor. As I breathe in and contract, I send the energy up. As I breathe out, I send the energy down. Breathing in, contracting, send the energy up the front. As I breathe out, I relax it all, and I let the energy go down my spine into my tailbone. Finding your breath in and finding your breath out as you contract in and let it all go. You contract in, and then you let it all go. Visualize the energy moving up and down the back, and up the front, and down the back. Breath in, breath out, breath in, and breath out, breath in, and breath out, and breath in, and breath out. Now just come back to your center, letting go of the contractions, the thoughts of contractions, and just recognize your breath. And feel the natural state of your breath, the natural state of your contractions, the natural state of your relaxations. Beyond the expansion, feel your space, feel your body, letting go of thoughts and connecting to your breath, the energy, and the natural contraction and relaxation of your muscles as you breathe in and as you breathe out. 5, 4, 3, 2, and 1. All right, my friends, have a wonderful day.